Yeah, so we can go ahead and get started. And I am glad you're here. I'm Ashley McClure. I'm a primary care internist in Berkeley and co-founded and co-direct Climate Health Now with Amanda Milstein. And we're glad you're here. It's kind of, I mean, it's like a great thing, but there's, we learned last week that there's another climate health event happening like literally right now. So it's really great that there's so many opportunities for these kinds of activities and events, but probably we'll have a smaller group because there's other things going on, which is really great in the grand scheme. But we're glad you're here. We have a really special guest, and we will go ahead and get started. So our theme today, because it's coming on to the holidays, I cannot believe that Thanksgiving is in like 2 weeks. 2 weeks, really shocking. But we thought it would be a really fun time to talk about food. And I hope that this is fun and inspiring, actually, because Zoe Novik, our special guest, will have some really great examples of hospital systems working on food and in the interest of health and climate. So next slide. And we also want to acknowledge, I feel like there's always, it's just a different thing happening every month, but what's happening in Israel and Gaza is super upsetting, and whatever side anybody's on, it's just really, really sad. So that continues to happen, and a lot of people are being affected by that. So as an acknowledgement. And always kind of going back to our North Star, we just like to revisit every month that Climate Health Now's mission is to organize and mobilize the California health community to advocate for equitable systems level climate action. That is what we're doing. We're glad you're doing it with us. I see some new faces, so we're glad you're here. Next slide. So we'll welcome our new members, and then have a special guest, Zoe Novik, share with us about health systems transitioning to more plant-based and plant-forward menus. We'll talk about CHN's new 501c4 affiliate, which is Climate Health Now Action Fund, and why we're doing that and why it's important and how you can help if you want. And then we'll get a brief update about the Sustainability Fellowship from Bill. I believe we'll be sharing that. I see he's here, so that's great. And then we'll wrap it up. So that's our outline for the hour. And let's skip that.
We'll skip that. Yeah, and maybe everyone.
Yeah, and since we're a smaller group today, we would love to just go around and have everybody share your name, if you want to share your pronouns, and what type of work you do, and then where you live/work. And we'll try to keep it to about 30 seconds, literally, for everybody, so we can all share. But that'd be great. How about I'm gonna go ahead and call on people. So Cindy, you want to go first?
Cindy, she, her pronouns. I'm a midwife and I work in a birth center in Berkeley.
I don't think we can hear you, Ashley.
Hi. Sorry, my bad. I muted on my end. I forgot.
That's
okay. Now Ashley's back. Kate, do you want to introduce yourself?
Yeah, hi, my name is Kate and my pronouns are she, her. I'm a current student at UC Berkeley studying public health, and I live on campus at Berkeley. It's nice to meet you all.
Awesome, glad you're here. I think this is your first meeting, right?
Yeah, this is my first meeting. I'm super excited.
Good, we're glad you're here. Thanks for sharing. And then we'll go to, excuse me, Helen next. Can you introduce yourself, Helen?
Is that me, Helen?
Yeah.
Oh, I'm not new.
Oh, we just were gonna hear it from everybody.
Oh, okay. I can't see everybody. I can only see Amanda, but yes. Okay. Sorry about that. So Helen Worth. I use she and her pronouns. I do predominantly support services and sustainability in healthcare. I'm transitioning out of my job at Stanford for the past 10 years into private consultancy, focusing in healthcare sustainability with a niche market in food service sustainabilities. And I live and work in the Bay Area in San Carlos on the peninsula.
Cool. That's exciting for you, Helen. That's great. Glad
Thank
you're
you.
And how about we'll go to Jeff next? And we're asking everybody to just say hi since we're smaller today.
Hi, Jeff Mann. He, him. I am an orthopedic surgeon. I work in Oakland and Berkeley at the Sutter facilities, and I'm trying to work on getting Sutter hospitals to decarbonize in any way I can, and also the entire orthopedic community. So both very simple tasks that I'm working on, and not making a lot of progress these days, but still trying.
Yeah, sometimes that means we need more partners. So we're glad you're here.
Yes, I agree with you there.
Me
Ashley, thank you.
Glad to hear. Yeah, we can definitely circle back to some partners for you. And then we'll go to Lauren next. Or Lori.
Yes. Hi there, you guys. Sorry, am I on mute?
No, you're good, Lori.
Okay, good. Hi, I am a ear, nose, and throat surgeon at Valley Medical Center in San Jose, which is a county facility. And I also have an academic affiliation with Stanford, and I am working more on sustainability things here in our enterprise, and also starting up a green otolaryngology group and with my Stanford colleagues.
Amazing. Woohoo! Love it. And then somebody just joined. The name says Kamid. Do you want to introduce yourself and say hi?
Oh, yes. Hi, Camille Dyer with the African Heritage PA Caucus. How are you? I'm thank you. Practicing PA in Southeast Florida in cardiovascular medicine.
Oh, from across the country. Cool.
Awesome. Welcome, Camille.
Yeah, we're happy to have
Thank you.
So Helen said hi. Alex, do you want to say hi?
Yeah, hi guys. My name is Alex Cheng. I use he, him pronouns. And I'm currently a first year at UCLA. So I typically live over in Claremont, where all like Claremont colleges are. But I'm on campus now in Westwood. And I am a climate science major at UCLA. So going in that direction.
Glad you're here. Alex did tons of legislative meetings with us. Well, a couple this fall. So we're glad you're here. And then we'll go to Jennifer Mertens.
Yeah, hi, I'm Jennifer Mertens, she, her are my pronouns, and I work at Kaiser in Kaiser Permanente in Oakland. I live in Oakland, and I do program planning and development around pediatric developmental disabilities, but I have a passion for this climate work, and especially in the intersection of plant-based eating. I'm a vegan, and I'm really excited to see this topic today. Thank you.
Cool, Jennifer. We should definitely follow up because as you'll hear, Zoe and I have been trying to push the dial at Kaiser Oakland. So maybe we could partner.
Yeah, we should talk.
Okay, good, great. And then Manny's with us. You want to say hi?
Or Palvine.
Or Palvine, do you want to say hi?
Hi, I'm Palvine. I use she, her pronouns. I'm currently in San Francisco. I'm a first year medical student at UCSF. I was just interested.
Great, we're glad you're here. It's an intense time of life. Good. And then we go. So Trisha, if you want to say hi. Okay, we'll come back if you can and want to. And then Bill's with us. You want to say hi?
Hi, I'm Bill Pevick. I live in Sacramento and I don't work.
Well, you used to work and you work on CHN.
Volunteer a lot.
What did you used to work? What did you used to do?
I was a professor of vascular surgery at UC Davis.
Wonderful. Bill's one of our healthcare sustainability resource team co-leads. Very grateful for that. And then we'll go to Amanda.
Awesome. And I'm sorry I messed up the audio previously. I'm Amanda Milstein. I use she, her pronouns. I am a pediatrician, mostly at Children's Oakland these days, and with Ashley, one of the co-directors of Climate Health Now.
Great. Did anybody not get to say hi? Wants to introduce themselves? Okay, wonderful.
Alrighty.
Next slide.
Do it. Okay.
So we just wanted to give, I want to give like a teeny frame to why we want to talk about food. And so I'm sure many of you are familiar with the really cool project and book called Drawdown, which is a kind of a manual, you could say, for how to achieve the greenhouse gas reductions that we need in the timeline we need. And so they kind of visualize all these different solutions, and it's sort of like a playbook for how to do it. And so if you'll push forward. So one of them is around food. And it's actually a really big one if we made collective changes, which is what Climate Health Now is all about. So that's why we're talking about it, is because moving towards, down the food chain towards a plant-based diet has collectively a much lower carbon impact, climate impact. And then we won't talk about this today, but also importantly, reducing food waste is a really powerful way to reduce emissions also. So we won't get into that, but that's also very important, like composting, preventing wasted food, etc. But so this is why we're talking about it. And the next slide. And, there's lots of things in the news about a plant-based diet, and, I saw these like ridiculous ads in Berkeley recently of kind of trying to guilt people into, if you care about the planet, then you should be vegan, and they're like really kind of obnoxious. And so obviously that's not the right narrative to do it, but the point is true that it is a climate solution, one of many, to, like I said, eat lower on the food chain. Next. And that's it. And the next slide. And then I think this is kind of an interesting visual just to show, food prints by diet type. So again, we're not at all about the personal carbon footprint. I think there's good research to tell us all that big oil basically invented the individual carbon footprint as a distractor, so they could keep making lots of money, and we'll just focus on our own individual guilt and individual changes. But on the collective scale, which is what we really want to focus on average, if we eat a more plant-based diet, so you can see on the left, if there's a really meat heavy diet, it has a greater carbon footprint per person in the population. So as we go down towards plant-based, then that follows along with lower emissions. And then next slide. So that is why we wanted to invite Zoe. So one of my friends introduced me to somebody who works with Zoe, and then I met Zoe through kind of conversations at Kaiser Oakland in trying to kind of do a pilot, which you'll hear about the kind of work they do, but at Kaiser Oakland, because the offerings at Kaiser Oakland are not plant forward. They're, there's lots of room for improvement. So Zoe, this is exactly what Zoe does, and she has a lot to share with us. So she's the healthcare program manager at Greener by Default. She went to Yale School of Public Health, specialized in behavioral sciences, and focuses on the connection of human health, animal welfare, and environmental health. She did Peace Corps, which is really cool, and she's passionate about creating a healthier world for all humans, animals, and our planet. And her work focuses on implementing plant-based defaults in hospital dining systems in the Bay Area. But obviously, was it Camille in Florida? They can totally work with you. I hope I'm right, Zoe?
Absolutely.
They can, they really help. What's so cool is that, most of us are really trying to do a lot in our hospital systems, and we need help. And that's exactly what Greener by Default does, is they don't even charge hospitals, because they have grant funding they've worked really hard to get, but they can really help us kind of create change in our hospital system. So the floor is yours, Zoe. We're glad you're here.
Thank you so much, Ashley. Hi, everyone. It's so nice to be here today with you all. As Ashley said, I am the healthcare program manager with Greener by Default. And every day I get to work with hospitals and healthcare systems mostly in California, but also branching out to other parts of the West Coast to help them implement sustainable food policies. And we do work all over the country. So if you're in Florida or anywhere else, we can definitely work with you. I'm just specifically stationed in on the West Coast. So I'll start by sharing a little bit about Greener by Default and our mission and how we work, and then I'll go into some specific case studies and examples. So you can go to the next slide. Thank you. Our mission at Greener by Default is simple. We are flipping the norm to make plant-based the default and give people the choice to opt into meat and dairy. So I'll spend a few minutes explaining why we're focused on plant-based foods. So as Jonathan Foley from the National Geographic explains, when we think about threats to the environment, we tend to picture cars and smokestacks, not our dinner. But the truth is, our need for food poses one of the biggest dangers to the planet. And you can go to the next slide. And next slide after that. Yep. So there's one sector in particular that has a particularly outsized impact. Globally, animal agriculture uses 77% of all farmland and produces 57% of all food-associated greenhouse gas emissions, but it only produces 37% of the world's protein. So the way that that works is plants produce most of the protein, the animals eat the plants, and then the animals produce most of the emissions. Next slide. And here from this diagram, you can see how that works. The most carbon-intensive foods are animal products, with beef, lamb, and cheese emitting the most carbon per kilogram of food. And chicken is often promoted as the sustainable choice and a solution to the emissions issue. And while its carbon footprint is much lower than beef, it's still 11 times greater than those of plant-based proteins like lentils and beans. Eating more chicken also poses a lot of public health threats, like feeding the chickens more antibiotics, creating more antibiotic resistance globally in human populations. Next slide. As healthcare professionals, I'm sure that you're familiar with these statistics on the prevalence and costs of chronic disease. So I'll just highlight a few how diet specifically contributes to those issues. 4 of the most expensive health conditions are diet-related, including diabetes and heart disease, and they account for over $500 billion in direct healthcare costs. You can go to the next slide. When we calculate which outcomes can be attributed to malnutrition, we find that they account for approximately 19% of deaths, 45% of deaths specifically from cardiometabolic diseases, and $50 billion in healthcare costs. Next slide, please. Nutrition science can be complicated, but there is a substantial amount of growing high-quality observational and experimental evidence linking specific food groups to cardiometabolic diseases and certain cancers. Specifically, diets high in the consumption of processed meats, sodium, and refined grains, and low consumption of fruits, vegetables, legumes, nuts, and seeds. Next slide, please. In contrast, diets rich in plants and plant-based diets offer encouraging health benefits. For example, systematic reviews and meta-analyses have found that higher adherence to a plant-based diet is associated with decreased risk of disease and early mortality. And research also suggests that a dose response is in effect, with higher levels of adherence to plant-based diets producing greater reductions in health risks. You can go to the next slide. Thank you. So by now it might seem obvious why we focus on plant-based foods. Eating and serving more plant-based meals is a critical strategy for reducing emissions and improving health. And this is particularly important in healthcare settings where we're supposed to be healing and bringing folks back to health. Within healthcare settings, there's really valuable evidence suggesting that plant-based diets can reduce short and long-term healthcare costs and improve patient well-being by decreasing medication use and healthcare utilization. One study of vegetarians found that they had 15% lower medical expenses compared to omnivores from the same population, while a study on vegans found that they took 58% fewer prescribed and over-the-counter pills compared to omnivores from the same catchment area. There's emerging evidence that plant-based diets can also reduce readmission rates, especially when administered through medically tailored meals, which is an area that we'd really like to see more progress and more research in. Next slide. Luckily, the market data suggests that we are, in fact, headed in the right direction with plant-based foods, meaning that they've been the top trends for the last several years. Over the last 4 years, plant-based menu items have increased by 800%. And in 2020, 57% of households bought plant-based products, and 23% of Americans claim that they have recently reduced their meat consumption. So when we look deeper into what's driving this trend, it's largely omnivores and health-conscious individuals. Just over half of consumers who buy plant-based products cite health as their primary motivator, followed by sustainability and animal welfare. And what I find particularly interesting is the chart on the very right that says 98% of consumers who buy plant-based meats also buy animal meat. And this is actually really great news because it means that we don't need every single person to go vegan in order to encourage nourishing, sustainable diets. We just need to encourage this trend of flexitarianism or reducitarianism, or omnivores who realize that we don't need meat at the center of our plate at every meal in order to be happy and healthy. And this is really the core of our work at Greener by Default, making it easier and more appealing for omnivores to choose plant-based options and getting outside of the paradigm that plant-based food is just for vegetarians or vegans. Our program at Greener by Default was inspired by the work of Nobel laureate Richard Thaler and Harvard professor Cass Sunstein. And in their book, Nudge, they examined the profound impacts of defaults and nudges on human behavior. So a default is the option that people end up with when you don't make an active choice. So for instance, I can almost guarantee that many of us on this call have the exact same phone ringtone because it's just the default setting that it came with. And I never bothered to go through and change the settings. I didn't really have a good reason to. And as Thaler and Sunstein explain, people tend to stick with the default or the status quo, partly because it's one less decision to make in our busy lives, and partly because defaults are seen as the more socially acceptable thing to do. We have this subconscious assumption as humans that if most people are doing something, it must be the right thing to do. And as much as we want to be unique or exceptional, we're also social creatures who like to fit in, and the surest way to do that is to mirror our peers and stick with the default. So when you combine plant-based foods with defaults and nudges, you get Greener by Default. We facilitate healthy, sustainable choices by flipping the norm. In just about every setting where food is served right now, meat and dairy are the default options. People have to specifically opt into plant-based options rather than the opposite, and which generally only vegetarians or vegans put in the time or energy to do. But Greener by Default is working to change that by making plant-based the default and giving people the choice to opt into meat and dairy. This way, everyone still has complete freedom of choice. Nothing is taken off the menu, but the more sustainable and health-promoting option is the default. This strategy is flexible and can be implemented in any environment where food is served across a range of cuisines and dietary preferences. It's also cost neutral and can often even save money and reduce food waste, as Ashley mentioned at the top. It's also more inclusive. Serving plant-based foods with the option to add meat and dairy includes everyone by default. It includes the 30 to 50 million Americans who are lactose intolerant, the majority of whom are people of color. It includes people who follow certain religious traditions that dictate a vegetarian diet or exclude specific animal products like pork or beef. It also includes young people and communities of color who are eating more and more plant-based foods. Black Americans are actually more than twice as likely to be vegan as white Americans, and a third of Americans of color reported reducing their meat consumption in the past year, compared to a quarter of Americans overall. Plant-based meals also allow for a more streamlined menu, and they reduce the need to stock specialty ingredients and ready-made meals that satisfy these dietary needs, which helps reduce food waste. And it also helps the culinary staff. You can click next. Yeah. While unwashed fresh fruits and vegetables can still carry some harmful bacteria and food safety practices remain paramount, reducing the amount of high-risk foods such as raw and undercooked meat, fish, poultry, seafood, and eggs can help lower your institution's risk of foodborne illness overall. Greener by Default programs are dramatically easier to implement and more cost-effective in reducing emissions compared to other sustainability interventions like installing solar arrays, incentivizing employees to use public transportation, transitioning to distributors with low-emitting transportation fleets, or more efficient distribution strategies, or identifying alternative suppliers of goods and services with reliably lower carbon footprints. Although the immediate effects of workplace health interventions are challenging to document in terms of cost savings, plant-based foods can improve the quality of the calories that staff are consuming in the cafeteria and help manage chronic diseases, which may reduce overall staff healthcare costs as well as the number of sick days used. You can go to the next slide. We'll skip this video. Perfect. Okay, so what does this actually look like in practice? I'll spend the next few minutes going through our top 5 strategies to implementing Greener by Default in different types of food service settings. So the core concept of this strategy is to make the base of the meal plant-based and give people the choice to opt into meat and dairy. So if folks are RSVPing to an event like a conference, it's a very clean switch. Just state that the food will be plant-based by default and ask people to check a box if they want to request a meat meal, the same way that people would usually request a vegetarian or a gluten-free meal. If food is served buffet or family style, you can offer the plant-based entrees first and meat and dairy at the end of the line or the meal. That way, people will naturally fill their plates up with delicious plant-based foods and use meat and dairy as more of a garnish rather than the bulk of the meal. If people are choosing from a set menu, make the base entree plant-based and offer meat and dairy as add-ons. This is already very common practice for restaurants with salads and bowls and fast casual chains, where the base is veg and you pay a little bit more to add your protein of choice. Next slide. When it's not possible to make the base meal entirely plant-based, you can create a plant-based default by offering a minimum ratio of 2-to-1 veg to meat options. A recent study found that when menus shift from having 2/3 meat options to 2/3 vegetarian options, selection of veg meals increases by 22 percentage points or 56% overall. And this is because when there's only one vegetarian or plant-based option, omnivores might perceive it as the special option that's just for vegans or vegetarians. So if I don't follow those diets, I might think that's not for me. And that decision can even be altruistic. Omnivores might be leaving the veg meals alone because they want their coworkers, their vegetarian coworkers who've been languishing hungry in the office for days, they might leave that for them. But when the ratio shifts to 2/3 veg options, we find that people are now making the choice based on taste, thinking, do I want black bean enchiladas or chickpea curry or pasta primavera? They're thinking about the flavors and what they're in the mood for that day, rather than whether they identify as a vegetarian or not. Next slide. Thank you. So subtle substitutions is another easy and effective strategy that we can implement. And this is simply serving plant-based condiments, milks, desserts, and breads by default. This is more inclusive because it meets the needs of those with allergies and dietary restrictions who are otherwise left without creamer for their coffee or trying to make a lettuce wrap when they really wanted a sandwich with bread. And nowadays, plant-based products are so good that people won't even notice the difference. We actually worked with one university that was trialing a vegan brownie, and they found that in blind taste tests, students actually preferred the taste of the vegan brownie to the conventional one. The vegan recipe had a lower carbon and water footprint and allowed more students to enjoy them. It was also cheaper and lower in saturated fat since they could use oil instead of butter. So all around, it's really a win-win-win. Next slide. Awesome. So to show just how impactful these small changes can be, one school district in Colorado replaced all dairy and eggs in their desserts with applesauce and oil, and they saved emissions equivalent to driving 57,000 miles, and they're saving over $13,000 annually. Plus, their budget and supply chain are not subject to the seasonal fluctuations resulting from zoonotic disease outbreaks, like the most recent avian flu, which hugely affected supply chain issues and the cost of eggs. Thank you. Our next strategy involves restructuring menus. So where there's a printed menu, ensure that plant-based options are incorporated into the main menu rather than a separate section. This is a really simple change. It might sound counterintuitive, but it can actually increase the selection of plant-based items by 56%. And again, that's because if I'm an omnivore looking at a menu, like the menu on the right that you see here, and I see the vegetarian section and I think, oh, I don't identify as a vegetarian, that's not for me. So I focus on the main menu. But if you look at the veg options incorporated in the other sample menu on the left, especially if they're listed first or towards the top, omnivores are more open-minded and let themselves choose what sounds delicious and what they're in the mood for, rather than what they think aligns with their identity as an eater. So if I'm an omnivore looking at the menu on the left, all of these dishes seem like delicious options. So if that risotto catches my eye and sounds good, I'll order that. I might not even notice the fact that it's vegetarian. Thank you. Another impactful strategy is labeling foods with names that are focused on taste, texture, and provenance rather than labeling them as vegetarian, vegan, meatless, healthy, or low fat. Now, it may be that people are more open to the healthy labels in healthcare settings, but studies for the general population find that people think that healthy means less delicious and less filling. And the same goes for calling items vegan. Some people think that vegan means it's got strange ingredients, while others might think that it's just for the vegans. So if I'm not vegan, it's not for me. We worked with a software company, and after seeing this presentation, they changed the name of their vegetarian hummus wrap to roasted red pepper, avocado, and hummus wrap. And they saw sales immediately increase. Another way to think of this is to imagine a menu that offered a celiac bowl, and you probably wouldn't look twice at it unless you had celiac disease or another reason to eat gluten-free. But if you saw Thai peanut rice noodle bowl, you might order it because it just sounds delicious and filling and not even think about the fact that it's gluten-free. And the same thing goes for vegetarian and vegan items. So now we'll move into our case studies. We worked with New York City Health and Hospitals to pilot plant-based defaults for patient lunches. Patients were first offered 2 plant-based chef specials, and then if they declined those, they were offered other menu items that were both animal-based and plant-forward and plant-based. And the hospital found that more than half of patients selected one of the plant-based chef specials, and approximately 95% of patients who choose the plant-based option are satisfied with their choice. The pilot was so successful that they have now implemented the defaults at lunch and dinner at all 11 of their hospitals. and they have an estimated savings of $500,000 this year. They also greatly cut their carbon footprint by about a third. And next slide. What's especially powerful about New York City's program is that they're serving flavorful cuisines that reflect the cultural diversity and preferences of their patient population. These are some of the dishes listed here on the side that they served this fall, which really illustrate how delicious plant-based patient meals can be and why this program has been so successful, really catering to the demographics and the taste preferences of their patient population. Next slide. We also worked with LinkedIn to implement climate-friendly ratios, that's the 2-to-1 ratio, and taste-focused labeling in their San Francisco office. And as a result, they were able to serve half as much meat per person while still maintaining high diner satisfaction. LinkedIn also implemented an oat milk default in their coffee bar, which means that all the coffee drinks were served with oat milk by default, and the barista would ask, do you want oat milk with that or an alternative? So that people were still offered the cow milk, but it was seen and treated more as an alternative rather than the norm. And this cut dairy milk from 70% to 18%. Blue Bottle also followed suit and implemented an oat milk default in all of their West Coast locations, and oat milk sales went up by 28%. So those are our core strategies. If you're interested in bringing Greener by Default to your institution, we would absolutely love to work with you. This approach can work in any food setting, in businesses, catered meetings, micro kitchens, cafeterias, universities, faculty meetings, conferences, and of course, hospitals and healthcare facilities. We also work with conferences and restaurants and cafes. So the typical way that we work, our process, we start by analyzing your existing menus, and then we provide you with a menu of strategies to choose from. Once you've selected the strategies that you want to test, we design the pilot to fit your specific goals and your specific food service environment. We then help collect and analyze the data, and when we are finished with the pilot, we help you tell your story to the world. This is a list of some growing number of institutions implementing plant-based defaults, so you will be in good company. And for more information, you can find tons of resources at our website, greenerbydefault.com. Or you can also email us, info@greenerbydefault.org, or my email is zoe@greenerbydefault.org. I'm also going to be sending out some resources and language around Greener by Default in a follow-up email that I believe is going out Friday. You'll be getting that from Amanda and Ashley, and I am happy to take any questions or facilitate a discussion.
Yeah.
Thank you so much, Zoe. This is such compelling, the evidence that you all have worked hard to gather is really impressive. And I think I saw Nupi just joined, who I know also works at Kaiser, and Jennifer. I really do mean it. I think there's a lot of opportunity for us to bring, to connect the awesome work that Greener by Default is doing to, any of our health systems. If anybody's inspired, having that external partner can really help things move forward. So we would love to take time and hear some questions. Is there anybody who wants to come off mute and ask Zoe some questions?
I can ask a question if there's. Zoe, can you talk about, so I think somebody said something at the beginning about grant funding and that hospitals aren't paying directly for this. Can you talk a little bit about how that works?
Yeah, so we are really happy and proud that we can offer our services completely for free for hospitals and healthcare institutions. We know that hospitals and healthcare workers are really spread thin right now, and there's just a lot going on in that industry. And so yeah, we're a nonprofit, so we rely on grants and donor funding, and we're very happy to be able to offer our services for free for hospitals.
I have a question in terms of conferences, and is there a significant increase in cost for the conferences with going with this option for the menus?
Oh, if a conference or an event, generally plant-based options are cheaper. The only place where we see more cost is at the very beginning when working with institutions. Sometimes there's some more culinary training needed, but the cost is really offset by the amount of savings from plant-based foods. And we generally don't see any catering costs going up.
Excellent, thank you.
Neat question, right, Camille?
Yeah, well, I've been involved with some conference planning, and I just know how expensive using the catering services at, whichever hotel chain you're using for your event or whatever the case may be. So that's why I was kind of curious on how that was impacted.
Yeah, generally we haven't seen any costs go up. We see either cost neutral or cost savings. And with conferences and events, it can be pretty easy to implement Greener by default because they're usually just, one time or annual events. And so we can really easily implement some like low-hanging fruit strategies to help omnivores, help everyone choose more plant-based foods. The RSVP option is, we find that that's one of our most impactful strategies.
And one question also, so I know Alex is, at UCLA, and Greener by default works not only with health systems, but like with any company, right?
Yeah, we work with universities, businesses, conferences, events.
Great. Yeah. We have time for maybe one more question, if anybody has one for Zoe.
And just to answer some questions in the chat, yes, I'm happy to share these slides.
Awesome, thank you. Great.
Good Lord, that's scary. Oh man, I'm gonna watch that. That's gonna freak.
Okay.
Actually, I have another question. One more question. Zoe, can you speak to, so like I have a 5-year-old child at home who is obsessed with impossible meat, like Impossible nuggets, basically like fake meat. Do you, which I don't know the health profile of eating fake meat, but it sounds like you all are not, it's really plant based, like plants as they were sort of originally intended, not fake meat. Is that right?
We have no problem with Impossible meat. We have no issue with any of these like imitation meats, because it's really about, we're happy to meet people where they're at. And although a more like plant-based diet that's really high in sort of whole food plant-based can be healthier, our goal is to really look at the whole system, all of public health. And so when you have someone eating an Impossible burger every day instead of an animal-based burger, they are benefiting the planet, they're benefiting climate, they're benefiting water use, food waste, and I think overall their own personal health. I think Impossible or any plant-based option is probably healthier. And so from the system's perspective, we are really ready to meet people where they're at. And we also find that often in hospital and healthcare settings, folks aren't really looking for a lot of imitation meats. They are more interested in a whole food plant-based recipe profile. Yeah, so we will sometimes recommend a blended burger of like, 30% Impossible and 60% like mushrooms and lentils blended together. If folks are interested in transitioning.
My 5-year-old would object to that.
I would. We'll go to Megan, and then also Zoe, we were going to share the recipe like database that you all use, so that'd be fun to share because we're going to send out like a summary on Friday. So I don't know if you could drop it in the chat now, or
yes, I will drop it in the chat and happily send it on Friday as well.
Giving recipes. Megan, we're glad you're here. Go ahead and if you have a question.
Yeah, thank you so much, Zoe. What a lovely presentation. I apologize, I came in a few minutes late, so I missed part of it. The question is, what is to date, it sounds like you have several health systems that have started to work with you to transition the menus. What is usually the MO? Is there like a standard pathway by which you find that introducing the concept of making this transition is easiest when you're approaching a new health system? I say this as someone who works in UCSF, but I think UC, there are other UC people here who might be curious. So like, do you like to start with food services? Do you start with the C-suite? Is there a different approach that works better?
That's a fantastic question. Thank you for asking. Often what happens is we'll have folks like everyone on the call today who are really invested and interested in bringing Greener by Default to their institution. And what we generally recommend is we are happy to have a meeting with anyone and everyone, particularly the executive chefs, the kitchen staff. We find that it is always helpful to have multiple people from multiple different levels on board with our program and with our messaging, and each institution is different. And so we're happy to work with you in any way, however fits your needs. But often if you get folks from within the UC system who might be working directly in healthcare, administrative folks, folks from the C-suite, never hurts to have them on board, and getting the culinary staff and executive chef buy-in and motivation is really essential as well. If there's green teams or like sustainability committees, getting their input and approval is really helpful. If there's like a diversity and inclusion committee, or folks interested in food waste or cost savings, it helps to have, because food system and healthcare system are so intertwined with every other part of our daily lives, it's really helpful to have multiple people from multiple sectors.
Ooh, awesome question, Megan. That was my question too. So I was like, who are the right people to go to? Because it's those roles that we might not know, but there's probably some patterns in the different systems. So yeah, well, I hope that everybody reaches out to Zoe, and here's her contact info, or if you need help from us, we're happy to facilitate that because we really believe in the work they're doing, and we're really grateful for the support. So thank you so much, Zoe. Thanks for joining us.
Thanks so much for having me. I just dropped the recipe database in the chat, and I'll send it out in the follow-up email as well.
Awesome. Happy almost Thanksgiving.
Awesome. Thank you, Zoe.
Yeah.
Thank you. Thanks, everyone.
Okay. Sorry, we're gonna, yes.
Awesome.
Okay.
So Bill, we'd love to hear how it's going with the Healthcare Sustainability Team's fellowship.
That's really a hard act to follow, though. My goodness, that was a fascinating presentation. Very briefly, so I think most people on this call are aware that the Climate Health Now has started a structured program to help individuals implement concrete changes to make their own workplaces more environmentally sustainable. We started out asking for pre-applications. We're happy we received 7 pre-applications, and we've invited 6 of those to submit a full application. They all sounded like good ideas. The only one we didn't accept really didn't have a project to suggested also, it really wasn't an appropriate application. We're trying to connect that person actually as a student who's not yet working at a facility, trying to look for a partner from Stanford, Tri-Valley Health, or Sutter. So if anybody's one of those systems and wants to work with a very motivated student, please let me know. We put out an offer to meet with each applicant prior to submission of the full application. We actually had a first meeting today, which was really, really engaging. Really very motivated. It's a group, it's a team, very organized, really good idea. It was a very good dialogue. And we're invited all the others to speak with us to help make their application better and their project better. And full applications will be due on November 30th. And at that time, we'll have to make a tough decision on these. Hopefully we'll get full applications from all 6, and we'll have to figure out how many will have the bandwidth to support. It may be all 6, maybe just 2, or somewhere in between. That's the update. Happy to answer any questions.
Great. Thank you, Bill. I'll drop Bill's email in the chat, and then Amanda's up.
Yes. Okay. Oh, there's Bill's email. And then Pam Lee, who's not on right now, is the other co-leader of the Healthcare Sustainability Resource Team. And a huge shout out to Bill and Pam and lots of people who have been working on bringing this fellowship to life. We internally thought maybe we could get 2 applications and that would be a win for our first year, and we got 7. So much where I was racing to try to turn off the application at the time of the deadline, because we were like, we can't support more than 7. So that was a good problem to have. I think I'm going to skip this in the interest of time. Okay. So I am going to share 2 related, but different aspects of other work that is going on within Climate Health Now. So I'll start by sharing, I think by now you all have heard that we know the outcomes of the 2 California legislative bills that we worked on this year. Success with AB 579, which is mandating the electrification of the California school bus fleet, which is super exciting. And then SB 394, which is a master plan for climate resilient schools, which was unfortunately vetoed by the governor. One thing that we are working on right now, or will be actually starting in the next day or so, is the coalition, the Climate Ready Schools Coalition, which is a wonderful statewide coalition of lots of different types of groups, is already thinking ahead to the 2024 legislative cycle, and specifically trying to get Governor Newsom to allocate money in the budget for this master plan. So we have been asked to get as many of the California health organizations, including groups like CMA, American Academy of Pediatrics, American Lung Association, if we can, to sign on to this letter. So if that's something you can help with, please let me know. We also are thinking ahead and starting to plan for our involvement in legislative campaigns for 2024. So if this is something that calls to you, please be on the lookout for more information or reach out to us to find more, to find out more. We are going to have much more information forthcoming with a plan to have an application for people interested in leading our legislative or co-leading our legislative campaigns in 2024 that will be out in January. So more to come on that. And now, very relatedly, I have the honor of making an ask of you all. So a lot of people on calls and off calls ask, is CHN just a C3, or how are we doing legislative advocacy? And the answer is we have an affiliated C4, which is called Climate Health Now Action Fund. And we are in the nascent stages of funding the Action Fund. Some of you probably are familiar with this, but it is more challenging. There are not very many grants for 501c4s, so we are really going to need to rely on individual donations in order to be able to expand our capacity, participate in more legislative campaigns, and train our members in how to do this. So our ask is, if you are able to donate, specifically it's a non-tax deductible donation to the C4. We are in the entering into the second week of our 4-week fundraising drive, or if you know others who might be interested, please share this link around. We would be endlessly grateful, and we think everybody will be, because this is going to enable this work that's so important.
Can we stop?
Yeah.
Is anybody feeling inspired or able to potentially donate? Literally, like whatever, but would anybody be able to possibly donate today? Raise a Zoom hand. Could you?
I will say this is very
I
hard
can.
for
I
Ashley and I to ask. So
Thank you, Bill. Thank you.
yeah.
Yes. This
May I ask a question I think may clarify?
Yeah.
I already donated, so I probably will not donate again
Yeah.
today,
Yeah.
but I
No,
think
you
there may be some confusion, and I have looked, I understand we got funding on the tax exempt side, the 503B, I don't know what the numbers are, and this is one allows lobbying. I understand there's two distinctions, but we're getting both kinds of money. So number one, what does one actually fund versus the other? What are we spending this money on? And then number two, if we're getting the tax exempt money, which restricts us from lobbying, how are we now allowed to lobby, so for instance, for specific bills, just because we're getting money from another pot? So I'm a little confused how this all works.
Those are really good questions, Bill. I think we can try to, the general gist of it is it's two entirely different, they're two different organizations. That's how, so it's really two streams of work and of funding. As a C3, we're fiscally sponsored by OGAN, the Oil and Gas Action Network. And so the grant money that we receive goes through OGAN, and that goes to fund all of our education work that we do, some advocacy work, because C3s are allowed to do a certain amount of legislative advocacy, everything around healthcare sustainability, community, anything that's not direct lobbying. The Climate Health Now Action Fund is logistically its own organization that's unrelated in any way to the fiscal sponsorship with OGAN, and that stream is what enables the work that goes into the direct legislative lobbying and preparing members to directly lobby.
But and also, I mean, right now, Bill is paying for our member database. And then it'll pay for staff time to do all the prep to get our members to do the direct lobbying. So to be able to say, like, Senator Wiener, we want you to support XYZ bill, that is called direct lobbying and has these restrictions. So, but we really want to do it because it's really powerful, and all of our members say that it means it's really meaningful to speak on behalf of a bill. And to be part of passing it. I mean, I really think we were part of passing the diesel school bus, the zero emission school bus bill. And we want to do more of that, but we have to do that with different funding. So it's, the details are ridiculous. We're worried about climate change and health, and we're like, all this IRS stuff, it's, necessary, but really not fun. So apologize for all the details, and we're running out of time, so I put a link to donate if you can and want to in the chat, if you're able, and thank you for even thinking about it. And they'll go to the next slide.
And I was just going to add, we are happy to talk more about this. We are up to our eyes in trying to get everything going, but yes, and I think just to underscore what Ashley said, it's what we want to do, and I would also say it's what the times call for, that it's just to educate is not enough, which is what C3s do.
So invite all your friends. Camille in Florida, we're glad you're here. We focus on people in the health community in California, but happy to be allies across the country, because you might not have as many, but you have a really great group in Florida, the Florida Clinicians for Climate Action also. But anybody in California in the health community, from nurses to therapists to public health to health students, we want them all to join, and they're all welcome to. So please send them to our website. Next slide. And just final save the date as the hours closing out.
Yes, awesome. And I will see, we have two things here. I was gonna, actually, Ashley, maybe you can
I'll put it
drop
in
in
the
the
chat,
chat. We're having an in-person fundraiser at Lily Chen's house coming up, not this Saturday, but next in Alamo. So if that is in any way proximal to where you live, we would love to have you there. And kids are invited. And then our last monthly meeting of the year is going to be December 13th at 12:30 p.m. And we will share both of those.
Yeah, we'd love for anybody in the Bay Area to join. It's gonna be a fun brunch, and we're trying to line up some music. Bring your family.
Oh, and apropos to this call, it's going to be very plant forward. So
Exactly.
by design. Yes.
Trying to walk the talk.
Yeah.
You'll have to specify if you don't want plant-based.
Yeah.
And then yeah, December 13th. So in a month, we'll gather for our final meeting of the year. Okay, thank you
Awesome.
all.
Alrighty.
Have a great day and a happy Thanksgiving if we don't see you. Bye.
Thank you. Bye.
Everybody.